Whole blood. In a female, there's about 4 to 5 liters. In a male, about 5 to 6 liters, really depending upon the size of the individual. For example, a 600-pound person has about 19 liters of blood. That figures out to be about 5 gallons. Blood consists of plasma and formed elements. The plasma is the matrix of this connective tissue that we call blood. It is very similar to interstitial fluid, except that there's about 5 times more proteins in plasma than there is in blood, than there is in interstitial fluid. And there's oxygen and carbon dioxide in different quantities. Oxygen is going to be greater in the plasma, and carbon dioxide is going to be greater in the interstitial fluid. It consists also of water and ions, which are continuously exchanged, and because they're continuously exchanged, the balances change on a regular basis. (46 to 63% of the blood volume is plasma, with an average of about 55%. Of that amount of the blood, the majority of it is water. About 92% of plasma is water. 7% is dissolved proteins. Remember that proteins is one of the deciding factors on whether or not a tissue is a connective tissue. There must be protein in the matrix. These proteins typically remain in the blood because of their large size as well as their globular shape. The most abundant protein in the blood is the albumins. About 60% of all the proteins are albumin. The importance of albumin comes into play with osmosis. As blood is moving through the capillary beds, fluids are moving from the blood into the tissues. Well, as it goes to the other side of the capillary bed, we've moved a lot of water out, and now all of the solutes, the proteins, the ions that are left in the blood are highly concentrated in comparison, and so they are going to influence the return of fluids back to the blood. The next most abundant protein is globulins, about 35% of all the proteins. Included in this group are the immunoglobulins, which are also known as antibodies, as well as transport globulins that bind small molecules and move them around the body until they are needed, at which time they will be released from that globulin. The next most abundant is a protein called fibrinogen. It is about 4% of the proteins, and this is a very important protein in blood clotting. In the blood clotting process, it is converted to fibrin, which then becomes a filamentous protein, which forms the framework for a blood clot. There's about 1% of proteins that are others, like, no, that's not correct. 1% of the blood plasma is other molecules, such as organic nutrients, including carbohydrates, lipids, amino acids, electrolytes. The electrolytes include sodium, potassium, calcium, chloride, magnesium, and so on. The electrolytes, especially sodium and potassium, are used for nerve impulses, and calcium is very important in muscle contraction. Lastly, there are some organic wastes in the plasma. As the blood moves through the capillary bed, it's picking up those organic wastes. Those wastes are transported to a site for decomposition or excretion, depending upon what needs to happen to it. A couple of examples are creatinine, which is a byproduct of um, phosphocreatine use in the muscle, and bilirubin, which is produced when blood cells are decomposed.